As someone who spent over a decade being misdiagnosed, fobbed off and ignored while suffering from a chronic health condition, I know exactly how it feels to be going to these people when you're in a vulnerable state, asking for help and feeling like you're not important. I know what it's like to be laughed at, to be made to feel like I'm a burden, to made to feel like I'm taking up resources that someone who's more deserving should be getting. I know what it's like when you try to voice your frustrations about the way you're being treated and people regurgitate these mantras to you about how the NHS is understaffed or they don't have the budget, as if that somehow justifies it, how that somehow means that I don't then have the ability to stand up and say, this is wrong, there's something wrong here. As if that means that I don't deserve to actually have any sort of help and anyone try and help me fix this problem. I know exactly how that feels. And when it goes on for as long as it did for me, I know how much that impacts your life. How you end up taking a backward step and fading away. How you get forgotten about. How you might even start pushing people away a little bit because you don't want to be dragging them down either. Because that's all you really are at that point, is you are someone with all these health problems and you can look after yourself, but you're no fun to be around anymore. Because you have to constantly just keep on being withdrawn and keeping yourself to yourself. It's a cold world when you're sick and unwell. So I know what you're going through. But if any of what I just said there resonates with you, I need you to understand that those people you're going to see, they don't care about you. And that's why you're not getting better. That's why they're not coming up with anything. It's no coincidence that these doctors will tell you that there's no solution to the problem that you've got. And they won't go home and question whether it's just that they don't know the solution. It's because they don't really care. And for the few well-meaning doctors or therapists or whatever it is that you've been seeing that you wouldn't want to be speaking negatively about because you like them as a person, if they're not actively looking for alternative solutions when everything that they've been suggesting doesn't work, then they don't care either. You have to learn how to stop confusing your like for somebody, the fact that you like their personality, for the fact that they can't actually fix it. It don't matter how much you like the person, if they can't fix the problem, then they're not a helpful person. And they probably don't really care. Because I can count on one hand the amount of people who actually did care, who were actually trying to help, and they didn't just stick to the same thing. They were trying different things. But ultimately, it was me who figured out how to fix it. It was me who paid enough attention to understand what was actually triggering the problems. And it was me who then was disciplined enough to actually see it through. That's not because I am far more intelligent than the average person. In fact, I would argue that I'm probably slightly under average. And if you're hearing that and you're thinking, well, I'm dumber than that guy, so I can't do it, that's because you've been trained. You're used to just thinking that you're not intelligent because you're handing over your authority to these people all the time, these doctors who position themselves as the experts but have got no answers, who put themselves there as the people that we need to go and trust and we're told we can't question, but they haven't got a clue what they're talking about. They tell you it can't be fixed. These people are usually fat as a house. Like if you look at the average doctor, they're not healthy. And you're trusting them with your quality of life, your ability to do the things that you want to do with your actual life. This is who you're trusting with that. And then you're wondering why you ain't getting better. You need to take your health into your own hands. You need to start paying attention to what's actually happening here. Document everything. What made it better? What made it worse? What's triggering it? You got to take this serious because it's you who's going to figure this out. It's not them. They don't care, but you do. And it's okay to care about yourself. You don't have to feel like you're doing something wrong for trying to figure this out. They want you to feel that way because they don't want to do anything. They're lazy. But you can rely on yourself to figure this out. And I'm speaking as someone who done that. And whether it's the lion diet for you or whether it's something else for you, there will be something that will help, whether they've told you it's impossible or not. Imagine if I'd have accepted that answer. Imagine if I'd have taken that and said, okay, the experts, the people I can't question, they're telling me there's nothing I can do. They're telling me that this is just something that happens as you get old. I'm lucky that I saw so many different people who contradicted themselves, or each other, sorry. I'm lucky that I had that experience. because it taught me that these people are often very, very wrong. And when it comes to chronic health problems, they haven't got a clue, because all they want to do is give you a pill and get you out the door. That's it. So stop giving over your authority to these people. Stop thinking that they're the ones that are going to figure this out for you, because they're not going to save you. You are.